Can you talk about what preventative measures do you think these patients should be taking after the curve starts to even out, as we've started to see?
Yeah, I mean, for the moment, I would say they certainly need to take the precautions that the general population is taking in terms of quarantining, using masks, hand hygiene, and, distancing themselves, both social distancing and also distancing from any potentially infected relatives or people they might ordinarily come into contact with. I think that's the most important thing now. And of course, to vaccinate as soon as a vaccine becomes available. That's absolutely critical, because you're correct in saying that patients with neurological baseline disorders are a relatively vulnerable population. They tend to have other comorbidities in addition to their neurological issues. Some of them are immunosuppressed by the very nature of their treatment regimen, and certainly need to take additional precautions if they are immunosuppressed beyond that of the average population.
Is there anything else that that people should know about, or the general population should know about, that they don't really think about when it comes to just neurologic symptoms and COVID-19 and this whole discussion just in general?
One thing we do want to get out to the community is that one thing that's been observed in New York City, for example, is much lower rates of admissions for our common neuro diseases like stroke, seizure, intracranial hemorrhage, or intracerebral hemorrhage. And, we speculate that some of those patients may be afraid to come to the hospital because they don't want to get infected if they come to the hospital, and yet they may need acute stroke treatment, for example. And so we really do want to encourage folks that, the organization in many of these hospitals is much better than it was at the beginning of this pandemic. And so you really do need to come in and get treatment as fast as possible. We're certainly afraid that a lot of people are dying at home from strokes and from very common neurologic pathology that is imminently treatable. And so people should really come back to the hospital and think about time is brain and getting treatment as fast as possible, irrespective of your concerns about COVID infection. So we do want to kind of get the word out about that amongst patients taking care of critically ill or providers taking care of critically ill patients. We'd also like to remind folks to think about neurological sequelae, even of protracted hypoxia, and consider really evaluating these patients both neurologically in an exam context, but also perhaps with imaging, which will help in terms of prognostication, family discussions, and even potentially goals of care conversations. So for the non-neurological or general critical care providers, we just want to remind folks to keep in mind that neurological sequelae are happening, and in some cases only being diagnosed by surveillance imaging. So just something to think about.